this June in New York, the UN General Assembly has held a high-level meeting on HIV/AIDS. 30 years into the AIDS epidemic and 10 years since the landmark of the UN General Assembly special session on HIV/AIDS, the world has come together to review progress and to chart the future course of AIDS response. As the representative from Global Action on Aging, we are very fortunate to have the chance to interview Dr. Paul Lay, who is the Deputy Executive Director of the UNAIDS. Dr. Paul Lay joined the UNAIDS in February 2003. As Deputy Executive Director, Dr. Lay works on implementing the new vision for UNAIDS, which includes the priorities of the UNAIDS Executive Director. He previously worked at the Global Program on AIDS at the World Health Organization and served as the Chief of the HIV/AIDS Division at the USAID. I'm going to interview Dr. Paul Lay at his temporary office at the Church Center, which is also the building of our Office of Global Action on Aging. So first of all, we want to ask Paul Lay to give us a general introduction about the AIDS problem globally, both in the developing world and also in the developed world. We want him to offer some insights on AIDS, especially for the elders, because as part of the Global Action on Aging, we are very concerned about the elders, the situation for the aging population affected with AIDS.
I think the issues about AIDS and aging populations are actually similar in both the developing world and the developed world. I think there's two major issues. One is prevention. We have tended to ignore aging populations as far as prevention messaging, focusing on how they can reduce risk. Even our data, even the epidemiology data that we collect tends to go up to 49. Only in the last couple of years are we now measuring prevalence in older populations and getting some sense of the risks as populations age. I think it's important to know that out of the 2.6 million new infections that happen every year, 60% of those are in people over 24. And that includes aging populations. So it's a myth to think that aging populations are not at risk. They do engage in risk behavior, and so we do need to tailor our messages. The other major issue is people who are already infected, thanks to the new antiretroviral drug regimens, which are quite effective, are now living into old age, and we're seeing special long-term problems that people who have HIV and are taking drugs have. They're prone to more of certain types of cancers, lymphomas and cervical cancer. They have problems with coronary vascular disease, hypertension. They have problems with diabetes. And some of this is due to the HIV, some of it's due to the side effects of the drugs. So as people are living longer, we're realizing to care for them, we need to care for them as an aging population, many of the same problems.
During the panel, we were informed that there is a lot of treatment programs, medical programs tailored for children. And we are confident that these programs could help the children who are affected with HIV/AIDS to better their situation. But we are really concerned if there is any similar effective medical treatment program tailored for elders. So we want to ask Dr. Paul Lay to see if UNAIDS is contributing efforts to establish medical programs for the elders.
We're starting to see in different countries focusing on older populations as far as prevention messaging, and we are definitely starting to see the caregivers starting to take into account these other diseases that people who are taking antiretrovirals are now developing. So we are seeing it. It's not but it's not yet a global campaign, which is something we do need, similar to the global campaign that we just launched. It's definitely something that has been neglected in the overall AIDS response.
Yeah, that's we have the clear data, like say how many children are affected with the AIDS globally,
right.
But do we have a similar data for the elders?
Recently, we are collecting that data, and the data is getting better. Part of the problem is the way surveys are done. Is the way surveys are focused as far as testing for HIV in general populations is we've focused on pregnant women as a major source, so that immediately restricts it to generally below the age of 50. We focus on high-risk groups, but we still tend to focus on younger age cohorts. The only time where we can sample older populations is when we include HIV testing in what are called the household surveys, demographic health survey, the mixed survey to a lesser extent. So we are getting some data on older populations, but it's not happening in every country.
Yeah, I understand.
30 years into the AIDS epidemic, we see a lot of efforts globally contributing to the AIDS problem. But we see one problem is that the education for AIDS is tailored especially to the younger population. And we are aware that there is still a huge population of the Asian population who are not aware about the consequences and the problems of AIDS. So there's a problem of how to tailor the message, how to inform the Asian population about AIDS and how to protect themselves.
UNAIDS works closely with countries when they develop their national strategic plans. Most countries have generally a 5-year plan as far as how they're going to respond, how they're going to do prevention, how they're going to do treatment. And when the timing is right, when the country is preparing for their next 5-year plan, we strongly encourage countries to go through a process that we call Know Your Epidemic, Know Your Response, which means to do special studies to find out where new infections are occurring. And what we've been finding when we do these Know Your Epidemic, that we have different tools. There's a tool that's called the modes of transmission, where we look at where the infections are happening, and we discover that the epidemic is changing, and we are seeing it in older populations. We're seeing in Africa more infections happening among couples, stable couples, rather than young people who are not yet married. And partly it's because they protected themselves when they were younger, but then they stop protecting themselves as they get older. So, and there is this myth that older people don't have as much risk behavior, as much sexual activity, and that's not true. And so there does need to be a more concerted part of the plan, the strategic plan, and it has to have a budget or it won't happen, that does focus on aging populations as risk.
Very special time of the UNAIDS high-level meeting on AIDS, and also with your 9 years experience at UNAIDS, we want to ask what are the biggest challenges that you see confronting the AIDS issue globally?
Well, we have a number of challenges that we're actually confronting at this meeting across the street at the UN. One of them is just the commitment to the epidemic. There is a fatigue now about AIDS, and people are looking at other problems, climate change, wars, terrorism. A lot of things are priorities, and they are priorities. Other causes of health problems for mothers and for children. So we have to remind people that the AIDS epidemic is still with us, and it's still very severe. So that's part of the challenge. The second part of that is having enough resources so that we keep and sustain programs, both prevention and treatment. We still are only treating about 1/3 of the people who need it. We have new tools, there's new research, new discoveries, but we don't have enough resources to incorporate some of the newer technologies. So we need to keep doing the investment in the research. We still need a vaccine, and we need a cure. So the reason for the meeting at the UN General Assembly is to remind the world that the AIDS epidemic is not over.
it is now.
With the very severe stage of the AIDS problem and also the challenges that you see confronting AIDS, could you offer some advice for organizations like us, Global Action on Aging, and probably other organizations? How would you say that we can contribute to the problem with our effort?
I think we need to make a concerted effort. The AIDS community, with groups, with NGOs, with governments, on the specific problems of aging populations, and we should be developing memos of understanding and collaborations and partnerships so that we make sure that this is no longer being neglected. And in fact, there is going to be a major conference in September of this year on non-communicable diseases. AIDS is a communicable disease, but non-communicable diseases are mainly the problems of aging populations. Strokes, heart attacks, diabetes, and we are going to, in the AIDS community, try to play a role at this non-communicable disease summit. We think it's very important. It's the first time that the UN has had a summit in the General Assembly on non-communicable diseases, aging population diseases. So it's I think it's a good opportunity to explore exactly what you're asking about, how we can have stronger partnerships.
We really appreciate that Dr. Pondelay could offer us the chance to interview him. And for us, Global Action on Aging, we are also focusing our research on aging for the aging population affected with AIDS. So we wish that in the future, we could offer more efforts to contribute to the problem with AIDS. And we hope that in the future, more population, more Asian people will be informed about AIDS, so there won't be unfortunate things happening.